Welcome. Today it is my pleasure to introduce Dr. Jim Hinoza to the show. Dr. Hinoza is a distinguished occupational therapist and current chair of the Occupational Therapy Department at New York University. He has co-authored numerous books, contributed to book chapters, and has had dozens of peer-reviewed articles published in journals pertaining to occupational therapy. My first question for you is, in your lecture, you mentioned that we are living in a time of hyper-change, rapid, dramatic, complex, and unpredictable change occurring in today's society, which creates unprecedented challenges. How should occupational therapists respond to such a change?
Thank you for having me today. In order to survive in this era, occupational therapists must do 4 things: plan ahead, create paradigm shifts, advocate to society about how occupational therapy adds value to patient care, and become innovators.
You mentioned innovation. How do occupational therapists become innovators?
Occupational therapists can become innovators in 5 ways. First, find an area within occupational therapy to focus your energies or efforts on. Second, find like-minded professionals who agree with your values. Third, be courageous. Challenge the status quo. Introduce novel ideas, methods, and interventions. 4, take part in interprofessional collaboration where you can learn from other healthcare professionals. And finally, listen to other occupational therapists with different points of view.
And in what area or areas do you see innovation taking place in occupational therapy?
For the benefit of the field of occupational therapy, innovation should take place in 3 areas: professional organization, education, and practice. But let me be more specific about how change could look like. In order for professional organizations such as the AOTA to stay relevant and benefit occupational therapists, it needs to streamline bureaucracy, advocate with other organizations, monitor government reimbursement policy, and provide outlets for dialogue. In education, there needs to be a shift away from a top-down approach and a focus on reasoning and problem solving. Also, different learning styles of students need to be taken into consideration. Research needs to be conducted by faculty and students, and there must be an interprofessional collaboration between departments in the university. For example, between occupational therapy, physical therapy, and speech-language pathology. Lastly, in practice, occupational therapists need to see if existing frames of references can be applied to interventions effectively, develop new frames of reference, and reflect on practices to improve who we are as occupational therapists.
I would like to go back to what you said about education and shifting away from a top-down approach. Can you please clarify?
Gladly. In order to foster an environment of innovation in professional occupational therapy schools, faculty cannot assume the role of dictating to students what and how they should think, do, and say. In other words, in order for progress to be made in the discipline of occupational therapy, groupthink and group speak needs to cease and be replaced by an open environment of questioning, critical thinking, and freedom to challenge traditional methods of evaluation, treatment, and intervention. By doing this, we pave the way for more effective patient treatment and better patient outcomes, which leads to better patient quality of life.
Today, in the year 2000, we are living in a time of cuts to programs such as Medicare and Medicaid. At the same time, private insurers are slashing reimbursement rates, creating an environment where occupational therapists are pressed to meet productivity goals by spending less time with patients, more time filling out paperwork, and fighting to be seen as an integral part of the patient care team. This has created a lot of stress and job dissatisfaction amongst practicing occupational therapists. How do you propose that we can solve this?
The issues that you describe are ongoing, but ones that can be mitigated through advocacy. Advocacy both by professional organizations such as the AOTA on behalf of occupational therapists and by self-advocacy by occupational therapists on their own behalf. As you mentioned, we are now in the year 2000, and the profession of occupational therapy has been around for around 100 years, Yet most people, even other healthcare professionals, do not know what occupational therapy is, nor what occupational therapists do. This needs to change in order for occupational therapists to continue to have a prominent role in patient care. We as occupational therapists need to educate others, including politicians who control medical funding, about how we can bring value to patient care through our non-invasive, holistic interventions which save money in the long run.
And finally, what impact do you hope that your lecture will have on influencing the profession today, in the future, and on both practicing and future occupational therapists?
I see my lecture as a call to action for both current and future occupational therapists. We as a profession cannot afford to stand by idly in hopes that the environment for occupational therapy will be made more favorable by others. Difficult financial and political decisions will continue to be made, and we as occupational therapists do not want, as the saying goes, to be left holding the short end of the stick. Both advocacy and interprofessional partnerships with other healthcare professionals are and will remain an integral part of our growth and survival as a profession. And lastly, my hope is that current occupational therapists and students will make tangible efforts to build, improve, and strengthen the profession of occupational therapy for now and future generations of patients to come. Thank you.
Awesome. Thank you so much, Dr. Hinosa, for joining us today and for going through these questions with me.
Thank you.